Hello and welcome to the New Indian Express. There is a surge in COVID 19 cases globally, with countries like Singapore, Hong Kong, and Thailand seeing a rise in infections. India too is seeing a new wave with surge of cases in Kerala, Maharashtra, and Tamil Nadu. In Mumbai, two recent deaths were linked to COVID 19. To know more about this, we have Dr. Rajeev Jayadevan, an expert who was the co-chairman of the National IMA COVID Task Force, who shall explain the situation regarding the virus. Watch more to find out. Hello, doctor. Welcome to the New Indian Express. Now, reports suggest that the coronavirus is back. What would you say is the current situation globally, and what is the current situation in India regarding the virus?
The coronavirus or the SARS-CoV-2 virus never actually went away. As we have discussed in our show earlier, it is a cyclical disease and it will keep coming back with variable intervals in between, which means that it can go on for several months without being seen much. And then we could see an increase in number of cases. You asked the global situation. This is mostly an Asian phenomenon this time around. Over the past few weeks, there has been an increase in cases in Hong Kong, Singapore, Thailand, and also in India. But that being said, from India's perspective, we know that a large number of people visit doctors with fever every day. Over the past few months, COVID did not feature on that list, but it is just that in the past few weeks, COVID has also found a place in that list. So, it's not like a very large number of COVID cases that are coming to hospital. COVID is featured among all the people who come with fever to hospitals. That's the way we see it here.
Now, doctor, is this the same variant as the last wave, or are we looking at a different variant or a more potent variant?
No, not really. In fact, ever since the arrival of Omicron in late 2021, all COVID variants have had pretty much a similar clinical profile, which means the way it infects people, the way they spread, the kind of diseases it causes, the death rate, all of that has remained more or less the same, with very minor differences between successive variants. So to answer your question, what we are seeing across the world is are basically downstream descendants of Omicron, specifically downstream descendants of what's called a JN.1 variant, which dominated the world for a very long time. JN.1 was one of the upgraded Omicron variants that followed, and now we are seeing downstream descendants of JN.1. Now, the Pango lineage classification gives all sorts of alphabetical names. There is no need to be alarmed or pay attention to the technicalities for laypersons. So suffice it to say that the variants we see now are similar to that that we have been used to ever since the arrival of Omicron.
Okay, doctor. Now, the most important question that's on everybody's mind: is the situation alarming on globally, or is it worrying in India with regard to the virus?
No. The reason for alarm mostly is uncertainty. We know how COVID behaves now. Unlike in 2020, it was an all-new disease. We had no weapons against it. There was no treatment known. There were no papers published. There was no vaccine. So it's a very different situation now. Doctors across the world, including in our country, know exactly how to tackle this condition. For the most part, information is the most powerful tool, in my opinion, because how COVID was conquered was really the power of information, the power of correct information, not only to provide good quality information to people, but also to curb misinformation. So on both counts, interviews like this have helped keep the COVID cases down. For example, people now know how to stop getting infected to start with, because we know how it spreads. It spreads through spreads almost like cigarette smoke. Like if I have COVID, when I talk or when I interact with people in a closed space, people around me will pick up the infection. It need not be through coughing and sneezing. So that is the major new development that occurred since COVID arrived on the scene. So if you are in a closed indoor space with lots of people, you might want to wear a mask, especially if you are vulnerable. In an outdoor and less crowded space, it's very unlikely it will spread unless you're talking with someone in very close contact. Periodic washing of hands and fingers after visiting public places is always a good thing, not only to stop COVID, but also to stop other viruses and other infections from entering our fingertips. Visiting people in hospitals is a social thing out here. I would discourage that because people tend to bring viruses to hospital and back. And the other thing is, if you have a fever, which is uncomplicated, stay home. Don't mingle with other people. So that will minimize the chance of spreading whatever you have to other people in the community. And if you have unusual symptoms or prolonged fever, by all means, seek medical attention, talk to the doctor, see if anything needs to be done. But for the most part, for the vast majority of COVID cases, they can be treated easily at home with rest, plenty of fluids, paracetamol if there's a high fever, good nutrition, and with very little medication.
Okay, doctor. Now, during the last wave, a lot of doctors and experts said that we have developed immunity against this virus. But why still, despite having immunity, why still do we face infections?
Okay, immunity occurs in two fronts. One, remember, let's take ourselves back to 2020. There was no immunity existing whatsoever. The only form of immunity you could get was to get COVID, and if you survived it, yes, you had some sort of an immune memory against it. So immunity, as I said, occurs on two fronts. One is the antibody response that you generate after an infection or a vaccine dose. Now, that antibody response is not going to last forever. It's the body's normal mechanism to wind down the antibody production after about 6 months or so, and then bring it down to close to zero, which means that infection is still possible after that window. But what the second front of immunity is what's called immune memory, which is called a long-term immune memory. Studies have shown, even in COVID, that if you have a bout of COVID or if you have vaccination or both, you have what is called long-term immune memory, which means that in the future, even if you get COVID, you will get away with a mild infection and your organs will not be damaged. Remember, so much of organ damage happened in the first year of the pandemic, and overall across the world, we know that 7 million people lost their lives on record. The true number is perhaps 4 times that number. So all of that, at least most of that, was because of lack of immune memory. And also, of course, there are frail individuals with compromised health in the population. They tend to have worse outcomes with most infections, including COVID.
Okay, doctor. Now, during my previous question, you listed out all the precautions that need to be taken. Other than that, would you, since we all know that coronavirus is here to stay, would you suggest any long-term lifestyle changes to cope up with with these infections?
From an individual standpoint, we must know the precautions to stay away from all sorts of respiratory viruses, not just COVID. Influenza is a very common and, in fact, dangerous viral disease that is prevailing here and in other parts of the world. There's a vaccine available for influenza, which can be taken on a yearly basis, which prevents against most cases of influenza. Many people take influenza lightly, and many people confuse it for the common cold. Influenza is not a common cold. It can kill a perfectly healthy young adult, and I've seen it happen. So it is easily preventable with a vaccine. Mingling with people with cough and fever is a bad idea, and people with cough and fever really ought to show responsibility and avoid contact with other people until their symptoms go away. And these are the lifestyle changes. And clean air is a concept that COVID brought to the world. Clean air, in the sense, we are more used to the need for having clean air for our breathing, and not only to prevent air pollution, but also to prevent respiratory pathogen, which means bad bacteria and viruses that hang around in the air. So the concept of clean air, just like the concept of clean water, must become part of our lifestyle. So, for example, if I walk into a room full of people who are coughing and sneezing, I might ask myself, do I belong there? And if I need to stay there, I might keep a mask in my pocket and wear it until I can get out of that room. So those are all concepts. We need to understand that the air we breathe is an important part of our health, and we can't take the air for granted anymore.
Okay, doctor, thank you. Thank you so much for talking to us, giving your expert advice at these uncertain times. Thank you, doctor.
Thank you.